We keep hearing that the world is shrinking. We're becoming an increasingly global community, and that means being better able to face the challenges that occur when countries and cultures come together. So what role can a university play in building a bridge between nations that are facing this swiftly approaching global future? Welcome to Out of the Blue. I'm Jen White, and clearly this isn't Ann Arbor, Michigan. We're in Shanghai, China, to learn more about projects the University of Michigan is engaged in abroad. We'll come back to Shanghai a little later in the show, but first we head north to Tianjin. China's economy and standard of living had been growing steadily for over 2 decades, and the city of Tianjin saw remarkable growth and improvements. But in the year 2003, the outbreak of the SARS epidemic seemed to threaten everything that the Chinese had worked to achieve. The epidemic passed, but not before China took notice of its antiquated public health system. Back at the University of Michigan School of Public Health, Associate Dean Matthew Bolton prepared for a trip to the Beijing Forum in 2006. As the former chief medical executive of the state of Michigan's Department of Public Health, Dr. Bolton bumped into one of his former employees, now director of epidemiology for China's National Centers for Disease Control, Dr. Zhangli Can.
It was from that personal relationship that over dinner, the two of us formulated the idea for establishing a larger training exchange program. Consequently, that resulted in an introduction to Dr. Shishu Wang, the Director General of the Tianjin CDC. Dr. Wang is a visionary from my perspective, and she immediately saw the potential for building a relationship with the University of Michigan School of Public Health.
So Matthew, give us a framework for understanding how public health collaborations with China work.
At its very foundation, it involves an exchange that they're sending individuals here for training and exposure to our public health system, and we're sending students and faculty to China so that they can be exposed to the public health system in China.
The China Scholars Exchange Program is now in its 3rd year. In May of 2010, Associate Dean Bolton traveled to Tianjin with 1 faculty member and 8 master's and doctoral students.
So this is the main CDC for this whole area that we're in right now.
Yeah.
Are there little CDCs, like a village or neighborhood CDCs?
No, we have...
Are there things about China as a country that makes it particularly beneficial as a place of study for public health?
Well, I think one of the tremendous benefits that contributes to the ease of operating here is that the Chinese government has very clearly made a substantial investment in public health, especially subsequent to SARS. China was embarrassed basically by what went on, and I think they committed themselves after that to improving their public health system. What's appealing about it is it is possible to get things done here in public health. So all the infrastructure is in place for collaborators to come in, work with the China CDC to make actual improvements in public health.
Before arriving in Tianjin, the scholars met with staff of the Chinese National Centers for Disease Control in Beijing, where Dr. Bolton's contacts have allowed for an unprecedented access to health data to complement the actual fieldwork that they undertake in Tianjin.
There's probably not as full a use of the data that they're collecting right now as there could be to inform their program interventions. So what does the TB data tell us as we look at that information we're gathering on patients, that we analyze it? How can it improve the program interventions that we undertake to interrupt transmission of tuberculosis in China, or identify more quickly people who have active TB so we can treat them and prevent them from transmitting to others?